Hi everyone, welcome to Real Life 101, the show where you'll get the inside scoop on real jobs, great career choices. I'm Jillian and I'm glad you're here because we've got a great show lined up for you today. Today we're going to be inspired by 3 different women who have carved a career path for themselves. But you guys can do these careers too, so listen up all of you. Gracie's going to visit a dermatologist and learn why she chose this field of medicine and the types of... Have you ever been to a dermatologist for acne or some other skin condition? He or she may have prescribed medication or removed a mole or other imperfection from your body. But what else does a dermatologist do? Gracie found out when she made an office visit to Dr. Kathleen Judge, sole practitioner of Central Florida Dermatology Associates.
We're here with Dr. Judge. Dr. Judge, tell me about your specialty.
I'm a dermatologist, which means I'm a physician that specializes in treating issues that happen with the skin.
What types of things would you be working with on your patients?
Well, it's a variety of things. Skin cancer is the thing that I do most often. So we do skin cancer screenings, educate patients on what to look for and how to protect themselves from skin cancer. But we also do children with eczema. We see children with eczema and take care of teenagers when they have their acne issues. And then I do a lot of cosmetic things too. So we treat wrinkles and do laser procedures and things that people want to fix about their skin.
So within med school, how much time is spent on your specialty?
Well, we do 4 years of medical school, and then there's a year of internship after medical school in another specialty. So I did an internship in internal medicine, and then 3 years residency in dermatology.
What's your favorite part of your job?
I like talking to patients. I like getting to know them. This is kind of a lifetime specialty. You see teenagers with acne, and then you take care of patients through their life. So I really like the long-term relationship I have with the patients.
So why did you choose this field?
I loved dermatology from the first day that we did it. In medical school, where I went, our first patient exposure was in a dermatology clinic. And I just love the fact that you can look at something and say, oh, this is okay, or this is something that we need to work on. It's a very visual thing. And I like the fact that I see babies, I see older people, I do a little bit of surgery, I do a little bit of cosmetic stuff. It was just the only thing that I wanted to do. When I was in dermatology clinic, I realized that that's what I needed to do.
What is your schedule like?
My schedule now is not bad. We work 4 days a week. We work from 7 in the morning to about 6 in the evening, 4 days a week. So we have 3-day weekends. I do skin cancer surgery 2 full days. Out of those, it's broken up. It's not 2 full days, but it's 2 of the 4 days I'm doing skin cancer surgery. I do a half a day of cosmetic stuff like lasers and fillers and Botox and things like that. And then the other times I just see patients in the office, just office visits.
So your schedule isn't quite as demanding as other types of doctors?
No, I don't see patients in the hospital. Some dermatologists do, and it's a preference thing. And that's the good thing about being a dermatologist, is that you can kind of focus on what you like to do and custom tailor what you do.
What advice would you give someone that's wanting to enter dermatology?
Dermatology is, I think, one of the most competitive fields to get into. So you have to study hard, you have to make good grades, and you really have to work at it. You have to be very dedicated and decide that's what you want to do and work every minute of the day that you're awake to get there.
What skills do you feel are important to be a dermatologist?
I think you need to be, a visual person. You need to be able to look at things and tell the difference between colors and textures and things like that in a quick way. You need to have good communication skills because you have to talk. People come in very scared sometimes. They have a black spot that's new and they're convinced that they're dying, and you have to be able to talk people down sometimes. So people skills is important, And I think you need to be a little bit organized to keep up with everything that you have to do as far as keeping current with what's out there, the new technology, because I think dermatology is one of the fields, because we use lasers, that and the fillers and the new cosmetic stuff that's coming out, there are a lot of changes coming every day, so you have to keep up.
Well, it sounds like a really great field.
I love what I do. I can't imagine doing anything else.
While some dermatologists practice general dermatology on the skin, hair, and nails, others prefer to specialize in areas like pediatrics or cosmetic dermatology. The services dermatologists offer are vast and range from diagnosing life-threatening conditions to preventing hair loss to treating simple skin conditions. Dermatologists will continue to be in high demand due to factors like rising skin cancer rates and advances in cosmetic treatments that keep people looking good and feeling good about themselves. For more information about becoming a dermatologist, click on the link on today's episode synopsis on rl101.com.